And we should be on. You're a millennial.
I know. I was going to say true millennials that we still have
we
a
do
part.
the side part.
Yeah.
Welcome to the Medicare Cafe pre-chat in the 2025 era, circa 2025.
Welcome. I hope you can hear me. I'm going to get used to talking into this mic.
So, obviously, like all good things, they have to change, they have to evolve. We have to stay current and modern. And I think Medicare Cafe was probably 5 years outside of current and modern, the way that we did it. We've been doing it the same way since it started back in 2015. This is like year 10 of Medicare Cafe. It's been almost the only change we ever made was that we took it from a webinar platform to YouTube Live, and that's whenever you joined. And like the host, that was a big change.
That was a little bit of a change.
Big adjustment. But this is, we are trying something completely new. We're so excited. So welcome to the first episode of 2025. Yay. We're excited to have you guys here. And I'm really excited that you guys are so nice because there's going to be a lot of trial and error.
A lot of trial and errors. I feel like I'm not going to know what to do with my hands. We were just saying we can't like touch each other. We might just have some hand holding.
I'm used
moments.
to just like cuddling. Have you seen like, by the way, this is the Medicare Cafe pre-chat. If you're watching the recorded version of this, this is your first episode, welcome. If you're just like, I don't want to hear about your lives, I don't care about any of that, just give me the good deets, then like skip ahead 2 minutes. But for right now, I haven't seen Carrie in a month. We're going to get a little caught up before we get into today's episode.
It has been a month.
It's been since the Christmas party, which was the 13th. It's been a month.
It's been a month.
Yeah. So how are you? How was your Christmas? How was everything?
It was wonderful. It went by too fast. I was actually like excited to have a week of snow days and one more week with my kids. But
really, you're the only parent that was like, yes, more time with my children over the holidays. Thank you.
It was good. How was yours?
We did Disney World, which...
Oh my gosh, that's right.
I was dreading. I'm going to level with you. I was dreading going to Disney. I'm not a Disney adult. I'm not into it. Also, I haven't done this in a month. I haven't done a cafe episode in a month.
Me either.
I took a month off. So, not off work, just off cafe. If you have questions, comments, concerns, threats, promises, text that number. That is my real cell phone number. You can text me at any time. I always want to make sure, like, if you're texting me during the show, I will read it and communicate with you. If you're watching the recorded version and you just have some questions and comments, text me as well. But Disney. Dreading it. But I knew it was just something that we had to do as a big family trip. I am planning my next Disney vacation. So much fun.
Did you have tons of lines? Like, that's just all I remember. I've been to Disney twice, and all I remember is you wait in line for 2 hours, be at the front, and Space Mountain closes.
You would have so many spreadsheets. I had a spreadsheet.
Oh, my gosh.
You would be, like, in spreadsheet heaven. Because you do have to be, like, that meticulous with your planning. You do have to be, like, down to, like, the...
Did you do it or have somebody do the planning?
I did it. You'd be so proud of me. You would be so proud of me.
Oh, my gosh. I am proud of you. Who
Spreadsheeted
is this 2025, Olivia?
I know. It's a new year, new me, new studio, new equipment. What is this? New equipment. But, yeah, it spreadsheeted the shit out of Disney, and it was awesome. I loved it. It was so much fun.
Did you just do Disney or do like Universal, Hogwarts, all that
don't
stuff?
Don't take away
Animal
this.
Kingdom?
I did really good, and it was just Disney.
Disney's enough in itself.
My Disney trip.
I just had to know if it was you had spreadsheets just for Disney. That's
it was
crazy.
just Disney.
So what was Cade's favorite?
Does it matter? I had a great time. He says his favorite was the character dining. We did a reservation for breakfast when you had breakfast with Mickey and the characters come. He is deathly afraid of like mascots.
Oh, really?
Yes, he's deathly afraid of mascots.
Oh my gosh.
But he does say that was his favorite because he had pumped himself up. He was like literally like rocking in a mirror and was excited to see. I'll post a picture of it in the Medicare Cafe group. But was excited to see he had got himself prepped for Mickey Mouse and nothing else. Like nothing else. Nobody else.
So he wasn't
mattered.
Excited to see anybody else?
He was not
just
excited
Mickey?
To see anybody else. Man. Literally just Mickey. Everybody else was terrifying to him. But it was so much fun. I can see if I can get the picture. You can see the terror in his face.
We took the girls to the Mizzou basketball game for the first time this weekend. And my 5-year-old was like, there's Truman. And he doesn't look too scared.
Oh, well.
But then my 3-year-old was like, was acting scared. And Summer was like, May, there's just a person in there. There's just a person in there. It's not a real tiger. So
they're so sweet.
Level-headedness from my 5-year-old.
Well, guys, it is time.
10:02.
It is 10:02. If you guys are again, you're saying, Olivia, you only had to fast forward 2 minutes. I fast forward 4 minutes, and this is just chaos. Brian, new backdrop.
Brian, we need
who
all the
dis?
feedback today.
We do. So that is a great point. So today, and I'm also adjusting. I have a keyboard to do the slides for the first time ever. I usually just use a mouse, and I have nothing. I'm going in blind. It is the blind leading the blind. So what we're asking for you guys today is just like give us the feedback. How do you like the new setup? It's going to get more. Like this is just phase 1 of our new studio.
It's gonna get more fancy.
It's gonna get more fancy, girl. You know who? And then and I'm also driving the bus, which is a problem.
I prefer you get slightly uncomfy.
Why does it smell like tequila?
There was a smell
You
to the
smell-
mic.
you
That's
s-
why I was sniffing it earlier.
Smells like tequila. Okay, moving on.
I thought it was like, I don't know.
Today we are talking. You thought metal? We are different people.
I don't know.
Today, on the first episode of the Medicare Cafe, this is actually a request by Carrie talking about.
Was it? Which is funny because I haven't even looked at the slide.
I know. Well, I made them this morning. Today we're talking about the January scaries. What is your not so fun to do list post AEP? Because we're kind of all still kind of. You're one of two camps. You're either like, yes, let's get back into it. The holidays are done. It's OEP. Let's smell that opportunity and go get that gravy. Or you're just like, man, that was a lot, and I haven't fully recovered.
I feel like if there's a theme for me in January, it's annoyed. If I'm being honest.
Okay.
Because it's like, oh, I have to work. I'm going to work. But then, like, you do it, you power through, and then it's just like all the calls of I told you this already. We've gone over this. It's just January is like an annoying feel to me.
In our business, we always say January doesn't count. The real year doesn't start till February
I
because
believe
January
that.
you're in prep mode. You're getting stuff together. Christy said
I do love
Cigna.
the prep. I do love the like prep aspect because
Yeah.
I'm such a goal person.
Your spreadsheets. Do you have a goal spreadsheet?
No, I don't have a goal spreadsheet.
Really?
No, I gotta physically write them down.
It's a good call. It's a good call.
Yeah.
So what are the January scaries? The January scaries are things like you just don't want to do, but you just gotta bear down and do it. And it's the hard stuff that honestly gets you the most referrals. It's the hard stuff that like you don't want to do it, but man, it pays off in the long run, and it is so worth handing that over. So let's talk about exactly what you're talking about. This was kind of your big thing. Like January
What
right
is this
now,
plan?
this year more than ever, you're going to be hearing so much from your clients about like, what the hell? I'm on slide 4. Help.
You're on slide 4?
Yes. What the heck did I sign up for? And like, I haven't got my insurance card. What is this deductible? My pharmacy isn't recognizing the M3P. What is this new mutual? Like, none of this is working like I thought it was going to.
All of that. And I think what's frustrating and again, the word annoying is I am someone who I make sure before my clients leave the office in AEP, I go over, here's the new Part B premium. I say their plan name 5 times, especially because a lot of times spouses, they're on 2 different drug plans, or they might be on 2 different plans altogether. And so, I'm like, you're going to get a welcome packet from Cigna. You're going to get a welcome packet from WellCare.
You're
I
giving
write
the
it down.
carriers a lot of credit that they're actually going to get that packet.
And
so
they
the Care
just
Bear.
seriously though. And it's and I get it. There's so much information thrown at them. I don't blame them, but sometimes it's just hard.
I'm the perfect person to practice on because I have the attention span of a goldfish.
Okay.
And so truly whenever somebody's in it, and that appointment, it is rushed. It is fast,
Yep.
especially this past year.
It is.
Everything changed. Every client experienced some sort of change, and it's not important until it's important. It's yeah, thank you, Carrie. Now I got to go on to my lunch appointment or something like that. There is nobody more busier. Nope. There is nobody in this world that is busier than a person who is retired. You know, that they will tell you how busy. And so, so they're not really listening to you. They're on to the next thing. And it's not important until it's important. So I think it's just have the expectation. It does not matter how much you explain during AEP.
It doesn't.
You are getting calls in January saying, what the hell did you sign me up with?
And I even after we do the applications, I print them. I send them home with them. But before I do it, I get my Sharpie. And in big bold at the top, I write Cigna. And then I write the premium amount on everybody. So they don't have to look through the fine print. What they have is right up there. And it just doesn't
It never fails.
doesn't
And
doesn't
again,
happen.
it's
Doesn't
and
stick.
for somebody like you who is going above and beyond and doing it just like a foolproof plan, and you're still getting so many calls. If you're getting a ton of calls right now between now and honestly, when you're gonna get them is when they go to the pharmacy. Like
Yep.
that's step one. When they go to the pharmacy, you're getting a call immediately after, and it's just expect it because it's not your fault as
Right.
the agent. The one advice I will give to you is, for the love of God, make sure that you are the phone call. It's annoying that your phone is ringing, but make sure you are the phone call, because if they call Medicare, that's a complaint.
Oh, yes.
It
Yep.
is because
Yep.
Medicare is assuming that you didn't describe it to them perfectly,
Right.
even though you did. You're the best agent in the world. If they still have questions, it's not because
Very
you
true.
didn't do your job, but Medicare will say they're filing a complaint.
Yep.
And so keep that in mind. So make sure, and plus, and if they call the carrier, especially if you put them on a PDP plan, it's not out of the realm of
For
like,
them to
oh, you don't like your PDP.
Right.
Let's try to get you in an MA plan, which
Yep.
again, like they have elections and stuff like that they have to go for. So it's annoying, but make sure you are the first call for sure. I would recommend, if you have the resources,
Mhm.
and by the resources, I mean the time or the personnel, to get in front of those calls and be proactive versus reactive and do like a welcome to your plan call. Because you know you're
Oh
going to
my
get
gosh.
them. I know. But they are 5-minute to 10-minute
Yep.
phone calls, and they will save you time in the long run for two reasons. One, you're going to get more products sold off of it, and
Mhm.
two, it will save you time in the long run. So what do these calls look like? Again, they can be done by you or your admin staff. Number one is an OEP reminder. Call centers, keep in mind, guys, the annual enrollment period for the little ones,
What?
the people who are younger.
What?
Well, I'm looking at you like you know the
annual
answer.
enrollment for what?
For people who are under age 65.
ACA?
ACA. That ends tomorrow.
Okay.
Call centers are about to skyrocket OEP marketing and which is, again, like I got to worry about compliance,
Yep.
but your clients are about to be inundated by call centers, especially because the ACA enrollment is ending
over.
tomorrow. So your clients are not safe.
Mhm.
Just going to say that out there. We've seen
Yep.
that with the data. So knowing that, like, reminding your clients, hey, if anybody else calls and they're not with me or my agency, don't answer the phone. You know, even if you get a call from your carrier, call me, because you might be getting some welcome calls or question calls or things like that. So just getting out in front of that so that you're keeping your book of business during OEP.
What are your thoughts on, instead of a call, realistically, like an email?
I think communication. I think a
An
call,
email could be much more doable
an email,
for me.
a newsletter,
Mhm.
something like that. Just some sort of communication, a TikTok video, like your social media, just some sort of communication. But I like this because what you're doing is you're teaching people, dwarves. Sorry. Have you seen the new advertisement for the new Snow
Brian,
White?
I didn't know where she was going with the little people either. She said little people.
Please don't cancel me. I just mean the
But
people
you were
who
talking
are
about
younger.
ACA. I think you meant younger.
I did, but they're the same in
But
my
little,
head.
I was on your page, Brian.
They're
I
the
have
same.
seen the previews for Snow White.
Terrifying. That looks like an awful movie. Not important right now. What was I talking about?
Emailing.
With this
communication.
conversation, what you're doing are things like,
Sorry, this tickle.
what a great day to have new mics.
I know, seriously. I'm so sorry.
When you're scheduling your dentist appointment, can I help you find it? Reminding them, you can read that on the slide. But what you're doing is you're just reminding them about, here's why you chose this plan.
Yep.
When you get frustrated, when you get mad about it, don't be mad at me. Here's all the reasons
Yep.
you chose this plan. Here's how to use the plan, because the more that they use it, the more likely they are to keep that plan.
Mhm.
And that's super important, guys, because we just got out of a crazy AEP.
Oh, yeah.
2026 AEP, this and what we're going to be talking about in 6 months from now is going to be as crazy, if not even
Gosh,
more.
How do you already know that?
Well, because so many carriers overbid, underbid, because
Yeah.
every carrier kept it so close to the chest this year about like
Mhm.
what they were going to do with these benefits, how they were going to handle the IRA, all of that stuff, that a lot of them came out and made major mistakes that it's too late to fix. It was too late to fix at the time. So you're going to be seeing some significant corrections. And keep in mind that CMS is no longer funding the gym memberships, no longer are cutting significantly the funding towards all those ancillary benefits like dental,
Wait, I didn't
vision,
know
hearing.
that. CMS isn't.
Will not be funding those, or is at least cutting funding for 2026 plans. So a lot of those bells and whistles that you're advertising and talking about right now will be, I don't think they'll completely
Interesting.
go away because the carriers, there's still a lot of incentives for carriers to have them.
Yeah.
But the funding, they will look dramatically different next year.
Oh, goodness.
So rest,
Yeah.
don't rest. There's no rest for the wicked, and We Are All Wicked, which is another movie I haven't seen yet. Where am I at? So again, and another thing I would highly recommend doing in these calls or in these communications. I'm saying calls, but in these communications, due to compliance, due to that scope of appointment, there are things in our last appointment that we could not cover that most of my clients want to make sure they're protected for. That
That's a
most of
good
my
one.
clients want to make
That's
sure
good phrasing.
they're handled.
Mm-hmm.
And that's going to help you sell things like things you couldn't talk about, life
Yep.
insurance policies, any financial products that you want
Mhm.
to offer. If you didn't talk about cancer or hospital indemnity, if you didn't have an opportunity because these appointments had to be so short and focused this year, just saying, I didn't have the ability to do that in our appointment in November, but most of my clients want to make sure it's taken care of. Do you have time? What's your availability look like next month? So it is going to make you more income. It is going to help you with
For
referrals,
sure.
and it is going to help you with retention. It doesn't have to be a phone call, but strongly recommend a communication.
Now's the time to do it for sure.
Mhm.
I've already had, and this is just from people that have reached out to me. It's January 13th, and I've had 3 people reach out to me about wanting to add dental.
Yeah.
So I've
And
added
expect
3
that.
dental plans in the 13th, and it's been 13 days. And if I'm proactive about reaching out to more, it would be even more.
Well, and it like you mentioned, like I just don't know that I have the bandwidth. I don't know how the time for it.
I know.
You have the time for it if it's a money making activity or a
Right.
money saving activity. And
Yes.
so like I understand retention is money making because it's a
Mhm.
lot cheaper to keep a client than it is to get a new one.
Yep.
But there is ways to turn it into something that is profitable
For sure.
and like revenue building
Right.
versus just like warm and fuzzies,
Yeah.
which is important. We love the warm and fuzzies, but like you got to make money doing this too.
I don't know if this is a slide on here because I didn't do my homework and look at the slides.
I gave it to you the slides like 15 minutes ago.
But I had another thought about the January scary calls. Not even them forgetting like their plan information, but yesterday I got my first call of somebody who, my drug plan premium went up to $45 and it was $9. This is ridiculous. And okay, sir, we sent the newsletter to you in AEP. We
Mhm.
tried calling you. We emailed you.
Do you do texting at all?
We text, yes.
Okay,
Yes,
so you
we
do
text
text?
too. Yeah.
Do you do any texting campaigns that's different? It's like a mass
Haven't done a
texting.
texting campaign. No.
It's complicated.
No.
For your current clients, you would have to prove that they opted into it. But like
Okay.
if so you don't have to like go and like text people one by one.
Yeah.
If you opt, you can have them like something called constant contact. It costs money, but it takes care of like 90% of the compliance stuff for you. If they
Interesting.
opt in, which could be like something on a client intake form, do you want
Uh-huh.
to receive text notifications? I'm so nervous because I have to burp into a microphone. And like, can you guys hear me gulp? Anyways, if they opt into it, then you could do like mass text. So like, I need to text everybody on a Cigna plan. I'm gonna send them. This is what your premium plan
That's
too.
interesting.
So you could
That's
do, or
cool.
if you had them in Medicare Center, you can also
Mhm.
do the mass emails too. I need to send a text message to everybody. It won't do it on text because again, the text opt-in is weird. But you can do. I need to send an email to everybody on my Cigna plan. Let me get that. Like, so if you're using the Medicare Center platform, it will pre-do that for you.
I love that on the PDP apps this year. I'm pretty certain 2024 was the first year that I've noticed it. But they had on there what's your preferred means of communication,
Mm-hmm.
which they haven't asked that like on any application before.
Mm-hmm.
And 9 times out of 10 people say text. Or at least of my clients.
It is. I mean, that's what. And if the carrier's not asking that, you as agents should be
Yes.
asking, what is your preferred method of communication? Because it is
Yep.
text.
It is.
More than not.
We just need an RCRM to like have a little communication thing at the very top. So like
Talk to Miro. He
I
could do
know.
that tomorrow.
I know.
Today. He's
Oh,
free right now.
because I'm top of his list
Let's
of
text Miro.
tech requests.
You know what? That is something, Terry, that we haven't addressed. I got a text from Terry. We have a disaster right now in California. Obviously. And we haven't addressed that. So I do want to apologize because to any of our California listeners, to anybody who has family in California in this affected areas, praying, deep thoughts, good vibes, whatever
So awful.
devastating what you guys
Absolutely
are
devastating.
experiencing. Yes, Terry, like, is that a thing for Medicare still? Interesting background. So that is something we do need to address about
Is
the
doing what?
disaster SEPs right
Oh,
now.
yeah.
There will be disaster SEPs. There
For
is no
sure.
question. We will see disaster SEPs for our California clients. No questions. However, starting after the first quarter, those are no longer eligible to be written by agents. Those are direct to consumers.
Oh,
The
interesting. Disaster. Jurassic would be a disaster.
That would be a disaster.
That would
But
qualify as a disaster.
Could you imagine all my nightmares from first grade coming true and dinosaurs are real? I mean, I know they're real, but like alive.
Alive?
I don't think I bet there are some good conspiracy theories around dinosaurs. Anyways.
Oh, yeah, for sure. There's got to be some.
There's got to be some good ones. But
Yeah.
back to what's going on with California. There will be some disaster SEPs, but we have until the end of this quarter for an agent to take advantage of them. After that, the consumers can still take advantage of those, but it will be direct to Medicare and utilizing CMS for those elections. Agents will not qualify to write those. For now, do I think that will get overturned? I do think there's a good chance that that's not going to forever a thing.
Because that's new, right?
That's new. I mean, like they just announced that 2 months ago.
Okay.
So just keeping that in mind.
And that ends first quarter.
Yes.
Okay.
The last thing I'll say about the scary January calls is just understanding, again, knowing that it's a time constraint, but you're getting those calls anyways. So if you're making the phone call, you're driving the bus, you're not kind of reacting to somebody else and letting them drive that conversation. So it might actually save you time on those calls too.
Yep.
Just keeping that in mind. Something else that is a little scary in January, a lot of us took some well-deserved time off at the end of December, other than just like servicing policy. Time off is different for an agent, right? You never really get time off.
No.
But servicing your policies, serving, like checking and things like that, we really kind of stopped. And so a lot of people might have some pretty empty appointment calendars going into the first part of the year. So it's just time to fill up that funnel.
You know what I'm filling it up with?
How? Tell me.
I have 2 meetings today with my strategic alliances. I'm just taking them out to lunch. And then I have a virtual seminar today.
Are you
all
serious?
January things.
Oh my God. And you know what? Same page, because I said events are a great option.
There you
but
go.
That is something I didn't put on here. It's just like, what a great time when you do have this quote unquote downtime. And downtime is anything that's not making you money.
Yep.
What a great time to fill it with strategic alliances and to make new alliances and to really get out there and be like, yes, let's find ways to partner. Because if you're waiting until right before AEP to do that, when it's important, it's not important until it's important.
Right.
It's way too late.
Yep. I always after AEP take out my strategic partners. Yeah. I just think it's so important to just sit down, and I hear about update on their business and they want updates on mine. Yeah. And it's one of my favorite things.
I do want to make one clarifying thing because it is OEP. We haven't talked a ton about OEP.
Yep.
OEP is expected to be as crazy. In fact, even in Delaware right now, I can't remember who the company is.
I just got licensed in Delaware.
Did you?
Yes.
Oh, there's a big Delaware opportunity.
Interesting.
How
That's
convenient.
So random.
So in Delaware, it's going to be the first time that this has ever happened. A major network has left I think I will find out what company it was, but a major network had left one of the biggest Medicare Advantage companies out there. And it's such a major significant shift that it's actually opening up, never happened before. There's
a hospital that's that large that it would cause that.
Opening an SEP.
Dramatic.
And a guarantee issuing to MedSup.
What?
This has never happened before.
From a network leave?
From a network. Let me see what the plan is. Now I have to look.
How is that fair?
Cigna, Brittany, long-time listener, long-time caller, my BFF for life. Cigna.
Excuse
in Delaware.
Me?
Not on you.
I'm just kidding. I'm hurt.
This is news. Yeah. So Delaware. If you have a Delaware license, you were about to see. It's the first time this has ever happened. It's such a major hospital left for the Cigna's network that it's opened up an SEP for Medicare Advantage plans and a guarantee issue to MedSup. Never has happened before.
It's a T65 couple, so they'll be
They'll
guaranteed.
have friends.
But yes, I know. Yeah. I know. It's so good for me to know.
They said that so aggressively. Shaylin's watching too. Thanks, Shaylin. He said Cigna.
Cigna's a bad word in my mouth.
It is for a lot. Cigna is still experiencing a ton of just
But
like
it's both
pending
on the
apps.
PDP
It's
side
both
and the MedSup side.
and the MA side. It's all Cigna products right now. And we wrote a ton of Cigna MedSup, right? Like we were seeing a ton of Cigna MedSup production coming in, and it's just. But we
Like,
do
I
have.
rarely have clients like mad. And I had 3 clients between November and December who were mad, and it was all Cigna MedSup issues.
I'll tell you, because every single time we talk about Cigna MedSup, one of my favorite people in the industry, I have lots of favorite people, but Tarek, who is the like St. Louis area rep for Cigna, so this is only going to help if you're in Missouri.
Okay.
But he is so hands-on. Like, that is something I will give Cigna. The Cigna reps are fantastic. Yeah, they're fantastic. Even though and they'll be the first
They're so much cheaper. It's so hard.
I know. And they actually like pay commissions on Missouri Anniversary too, so it just makes it that much harder.
Yeah.
But if you are having Cigna MedSup issues,
Call him.
call Tarek.
I need his number.
I will get you his number, because every time we talk about it, he's a listener, and he says,
I've written way too many.
Start talking to me about this. So I will send you Tarek's number, but
Please
he's
do.
fantastic. He's come and spoke, but he's a friend
meet
of the
him.
show. He's been to our office several times.
Mm-hmm.
Used to DJ in a past life. One of the coolest guys.
There you go.
But their reps are fantastic.
I just have a little disclaimer.
And he's on the Advantage side. I take that back.
not
He's not on
MedSup.
the supplement side. He's on the Advantage side.
Okay.
Our yes, Christy, we will get you that info.
Anytime I've quoted Cigna lately, I'm like, hey, listen, this is going to save you like probably $30 a month per person.
Mm-hmm.
But we've had a little bit of just like administrative issues with them.
Yeah.
So if it's worth the $30, it could go smoothly or it could be a complete disaster.
It could be a disaster. Yeah, that's.
People have still chosen it.
Yeah, I mean,
But I
money
feel
talks.
better after my 3 mad clients. I'm like,
But you know
all right,
what?
listen.
Like, at the end of the day, they're going to purchase they're going to purchase what they're going to purchase, even if you know what I mean. So like,
right.
The fact that you were giving those disclaimers and being like, I can only go.
Well, I
do
didn't
so
back
much.
then.
Yeah,
I didn't back then.
it's all about expectations. Success is measured by how well expectations are met.
Yeah.
So it's not a fun point, but I do want to make one thing, one little
comment,
but clarification. That's the word. Okay, I'm ready. OEP marketing.
This must be intense.
It's not. Everything's just more intense with you.
Yes.
OEP marketing. We know that
We know.
We know that it is not compliant or against compliance to market
Yep.
OEP. You cannot do any advertising that's like, you still have time. It's OEP.
Yep.
You can't do that. So a lot of people, when they see advertisements for insurance agencies or events or things like that, they're blasting them all over social media and being like, how are they allowed to do this? You can't do OEP marketing. The rules are, let's clarify 2 different things. Marketing versus informative, right?
Yep.
So if it's your current book of business or your current clients and that's who you're targeting for, you are absolutely in your rights to
Inform them
let
about
your
OEP.
current clients know that it is OEP if they're unhappy with their plans, that you as their current agent can help facilitate them changes and shifts. So that is a current client that is communication and information versus marketing.
Yep.
What you cannot do is do a Facebook advertisement or some sort of any type of campaign that is using OEP as an attention grabber. So you can't say, again, do a seminar saying it's OEP, you have time to switch.
Right.
Can't do that. What you can do is continue to host events, continue to host education, continue to even do sales events. You can do a sales event with United Healthcare and anybody where you're talking specifically about and have the ability to take plans, but you just can't advertise that it's OEP within that. And your advertising and your marketing, you cannot advertise that that is something going on, and people still have that option to switch.
I don't think I've even done a TikTok video or any video on even explaining OEP.
You absolutely could and absolutely should. Doing a video just saying, hey, you might be hearing that, you still have a time, you still have a chance to move. This is what's going on right now. But if you're happy with your plan, stay put. However, I would recommend go to your pharmacy, try the over-the-counter. Try your plan now. And if you're not happy with it, come let's talk.
Let's talk about pharmacy. I just had a total derail thought.
Because we've been so...
What have you heard anything about the payment plans?
Yes, I've heard a
How
lot
have
about the
that
payment
been going?
plans.
I haven't heard. I just realized I haven't heard a single thing.
I'm hearing it from carriers. Again, the M3P...
Or the
Pharmacies have no idea what's going on.
Cool.
A couple of them do and have no idea. So carriers are honestly so uninformed. Like carrier reps, not reps as in like the people like when you call a carrier, when you call an 800 number,
Right.
90% of them are so uninformed on what this is and how to facilitate it.
Yep.
So Medicare Center, my team just informed me, Summer just informed me the other day that Medicare Center now has most of the forms to get somebody enrolled at the MP3. The carriers are saying that you have to do it at the pharmacy. You do not have to do it at the pharmacy. But
That's what I thought you had to do
a lot
at
of the
pharmacy.
carriers, that's what the carriers are telling us, and it is not accurate. There are forms you can fill in. You can do it at the pharmacy, but the pharmacists have no idea about this for the most part. Obviously, you have some other people who are more educated. But every carrier has a way. They're usually faxed. They're not easy to do because the carriers do not like this program.
Okay.
It's going to be very costly to them. So they're
I'm
obviously
sure.
not advertising it. They're not making it easy. Senior marketing specialists, we do have the forms to get somebody enrolled in the M3P for like 90% of the carriers. So if you guys are wanting to do that, we do have all of those forms available right now.
Medicare sent out a letter about it. I think it was at the end of December because I got a couple clients calling asking about this payment plan. They were like, what do I need to do to set this up? And I'm like, no. You don't have to do anything.
Yeah. Well, they will have to opt into it
I mean,
if they want
like
to use
those,
it.
Yeah.
But we have all the forms because again,
Okay.
like they're buried in carrier sites, and most of them aren't even on the carrier site. You have to call and get them, and when you call and get them, they'll say, "Oh, you do that at the pharmacy," and that's just not correct. And it's not like those people are being nefarious or lying to you. They're just temp workers that are still here after AEP that haven't been trained because they were hired in a frenzy.
So if we get the papers from you, are we turning them into the carriers?
Yes, you turn them into the carriers.
Turn them into the carriers.
Yes. So it's just a lot. It is a lot. And again, I've had two carriers. Cigna was one of them. UHC was another. That's saying we're getting a lot of questions about this. Here's our information. So they both have been really upfront, upright about everything. Most of the other carriers have remained very quiet about the Medicare payment program. So
I've had no experience.
Medicare
with it
prescription payment program.
Yeah. Just call it the payment plan.
M3P.
Which I probably should.
It is what it is.
MP3.
M3P.
That was like a
M3P.
Wasn't that like a little
it was a music player. The iPods, right?
Oh
iPods are the M3P, MP3s.
Yeah.
LMNOPs. Okay.
I don't know what slide you're on, girl. I'm supposed to tell you.
I'm nailing it.
I think you were like 4 and then 1 and then 2.
Girl, I'm killing it.
Okay.
Other things to keep in mind, guys, your AEP checks. Carriers are starting to talk about when you're going to be seeing your commissions for AEP business. Make sure this is the perfect
checks
time.
are then money.
Money,
I was like checking. What am I checking about AEP?
No.
Got it.
No, it's your money. It's
Got it.
dollar bills. When you have that check in your hand and you look at it, remember two things. Taxes.
Oh, yeah.
You have taxes that are going to come out of that check. And 2, that money is best used to reinvest in your business.
Yeah.
So making sure when you're looking at that money, look at it.
Like going to Hawaii on a business trip.
Like going to Hawaii on a business trip. Are you at me? When you're
that's talking to me too. I'm excited.
I'm so excited. When you're looking at this, you need to make sure that you have a marketing budget and a marketing plan. So many people overlook that. And if you don't have a marketing budget and a marketing plan, 2 things will happen. 1, you do not invest in marketing, and your funnel and your brand recognition will suffer for that. Or 2, you invest in your marketing recklessly and you don't track it. You don't know if it works, and you end up overspending in ways that are not effective for your business.
Yep.
So get yourself a
plan.
spreadsheet, look at your check, budget out your annual, what you're willing to spend annually. And that can change quarter to quarter, but just start out with the budget and start planning ahead for that. But understanding that, like, yeah, you're going to have to pay some taxes on that. So, worst.
Something that, like, in our annual reviews that I love that our managers ask us is there's 3 questions. What do you want to stop doing? What do you want to start doing? And what do you want to continue doing?
Yes.
And I just love that.
I think huge.
Yes. It's just a good way of thinking about your past year.
Yeah. I think too, like, people don't do this as often as they should. It's so ingrained into the culture where
Mhm.
we are. But goal setting
Oh,
and
yeah.
writing down your goals, it is
Mhm.
incredible how impactful that is. Just kind of planning out your year. What do you want to accomplish? What is your 1 year? I always do a 1 year, a 5 year, and a long term.
Yep.
That's always where,
Yep.
I'm actually up on my 5 year. I started my 5 years plans back in 2020. So I'm on my last year of that goal. And it's crazy, like things I revisit, and it's just like, I did that in my sleep. That was something that
Oh,
was like
yeah.
such a big, like, could you imagine that this actually happened? What
Mhm.
would that look like? And like, they just happened, but I don't think they would have if I hadn't put that out into the world and written it down.
Isn't it you like undershoot your 5-year goal and you overshoot your 5-year, your 10-year goal?
There's like, have you heard?
There's something.
There's like the BHAGs, right?
Yeah, like I think, don't you like overshoot what you can do in a year and undershoot 5 years? There's something. I don't know. Ignore me.
I don't know. You're the
I don't know.
spreadsheet person. Whatever you say, I'm going with. I have no, yeah. But no, it is. There's just something about
You can do
giving
more than you
yourself-
think, I guess
giving
is what I'm
yourself
saying.
vision. Shoot for the
Yes.
moon, because even if you miss, you'll
That's
land
right.
amongst the stars.
That's right. That's right.
Guys, I appreciate you guys hanging out with us for the first meeting or the first Medicare Cafe of 2025. Make sure you join us on Facebook. That's all we have for you
Look
guys
at that.
today.
There's no hiccups with the slides at all. You were doing amazing.
Listen.
Just me and my little tickle in my
I
throat
shot
today.
for the moon and I landed amongst the stars because I really didn't think I was going to go well.
You did great.
Thank you. Your hands are so warm. Mine are not.
Oh, are they?
Yeah.
They've been wedged between my legs.
That's a different show, Carrie. Thank you. Appreciate you all so much. If you do have any questions, comments, concerns, threats, or promises, or you're watching the recorded version of this, thank you for playing along. Thank you we're going to continue to build this out, be cooler, be better. I think we're even talking about turning this into a audio format. I'm looking at my team. I also have people in here now. Usually it's just Carrie and I. I have a Sadie and I have an Alex in here. So that's very exciting. Hi, Alex. So I think we're even talking about turning this into a podcast format if you can't watch
Ooh.
the live version
There you
of
go.
this.
There you go.
We got a lot of really incredible things. Thanks to the team, Alex, Sadie, obviously Carrie, Ben, Clayton, an incredible team at Medicare Cafe. So yeah, be looking out and be looking forward to some really incredible things we have planned for you guys.
That's awesome.
Anything else?
Don't think so.
Okay.
Have a good 2025. Make those goals.
Plan all the moons and get the stars. Until next time, guys, have fun
Make money.
and give impeccable service. Thanks, guys.